In the state of California, there are 1,205 nursing homes. Statistics show that 1 in 10 elders will experience abuse, and only 1 in 14 of them will take their cases to the authorities. Many elders are often afraid to report their abuse because of the possible repercussions they will experience. Oftentimes, they are mistreated even more after a report has been made. Many elders in nursing homes can also be in an unconscious state, which enables them from being able to report their abuse and abusers. Also, most families wonder how their loved ones are being treated in nursing homes when they are not around. They want to make sure that their family is being responsibly taken care of. Nursing homes are oftentimes the center of horrendous accusations of abuse and sometimes even murder. Whether these accusations are true or false, it causes bad publicity for nursing homes. In the times where the nursing homes are innocent of any wrongdoing, this publicity brings a bad reputation to them. All of this can be stopped by simply adding cameras to every room in nursing homes, besides private areas such as restrooms. This can protect not only patients, but also innocent nursing homes.
Lately, in the past 10 years, elder abuse in nursing homes have increased, and in all 50 states, there are many cases of neglect, abuse, and exploitation that go untreated and undetected. In one study, it was estimated that only 1 in 14 cases of elder abuse comes to the attention of authorities. Interviews and research show there are many reasons for the abuse that they have their own research brief. For example, there's a research brief in adults with disability, another one in mistreatment of Latino elders, a mistreatment of lesbian, gay, bisexual, and transgender elders, and one in Asian Pacific elders. To addition to just 1 in 14 cases coming to the attention of authorities, the elderly may not report the abuse themselves because of fear of retaliation or their physical health does not let them. In 2000, one study of 2,000 nursing home residents reported that 44% had been abused and 95% said they had been neglected or seen someone neglected. The elders who experience abuse have a 300% higher risk of death, as well as have higher levels of psychological distress and depression or anxiety. They have high blood pressure and heart problems.
Currently, there is no policy that provides a way to obtain reliable evidence that proves or disproves claims of abuse or negligence in nursing homes. Because each case of abuse and negligence is different, cues that formed from incidents in the past may not present in the existing case. In addition, signs collected from data like unexplained bleeding, isolation, weight loss, etc., may be symptoms of diseases, psychological disorder, accidents, and not necessarily abuse. False accusation would cost the career and reputation of innocent staffs. Also, medical records will be inadequate to convict or acquit the accused. The progression of a disease may be due to the lack of medicine or the patient's weak immune system. And additional medical conditions can be the effect of abuse or side effect of a prescription medicine. Testimonies are not as helpful in this situation either. For example, a resident with dementia may mistake past memory as an occurring situation. A staff member was broken by bias due to the questioning style of the investigator, influence of colleagues and supervisors, financial pressure, or other personal reasons. Therefore, to protect the residences and facilities, surveillance is a must. The well-being of the senior citizens in the community and the credibility of the nursing homes are priceless compared to the total cost of camera in the facilities.
The cure for this problem is to simply add surveillance cameras in all nursing homes to avoid all mistreatment that is happening. The cameras will be in all rooms except the bathrooms for the fact that elders still need privacy. The video footage will only be seen by doctors and the family members of the elders. This will not improve the treatment, but also the awareness that the caregivers have with the elderly. This will keep the families at ease and relief to know that their family member is being treated correctly. In addition, the surveillance cameras will help the number of elders that are being mistreated by the person who is to take care of them decrease significantly. This will help keep an eye on the elderly even when they are alone and prevent anything worse from happening if the elder were to have an accident. Not only will this help find out if any mistreatment is happening, but also to help discover the worst. I don't even know what. This will help keep an eye on the elderly even when they are alone and prevent anything worse from happening if the elderly were to have an accident. Not only will this help to find out if any mistreatment is happening, but also to help discover the truth if any false accusations were to be made in behalf of the caregiver or even the elderly.
Over the past 10 years, 2,000 cases of elderly abuse have been reported. We ask ourselves how many are unheard of or unsolved. Many elders are unable to speak of their abuse due to embarrassment, fear, or because of their incapability. In order to prevent negligence in nursing homes, we've concluded that the installation of surveillance cameras will reduce and possibly eliminate the rate of elderly abuse. Surveillance cameras will advocate protection of both the patient and the facility. Surveillance cameras will ensure that all patients are being cared for properly and correctly while still maintaining their privacy. The facility will be protected by being able to see if employees are doing their jobs correctly, which will prevent the facility from obtaining a bad reputation. The installation of surveillance cameras in these facilities would not deprive patients from their privacy, but ensure a better quality care.